I think that we're very high density packers. We're very cognizant of all the physiology that's involved in high density. We don't do this blindly. We believe we can pack grafts or hairs very close together, ensuring that most, if not all, of those hairs will grow over the next few months for the rest of the patient's life. And that's what we pride ourselves on. The way we place our grafts in, a little different than the way a lot of the hair transplant community is doing, but I believe a lot of people are beginning to see the way we're doing it, and they're beginning to adapt it to their own practices. And I think that gives us great strength.